Hey guys, welcome back to Medical Coding with Blue. It is Q&A Tuesday. But before we get into all the exciting questions, I hope you've taken a second to like and subscribe and follow me on my journey in medical coding. And I hope that you'll share this with other medical coders that you know, because the whole point of my channel is to share information and to answer questions. I'm a veteran medical coder. I've been a medical coder for over 10 wonderful years. So I've been there, done that, and gotten a t-shirt. But anyway, let's go ahead and get into the questions. All right. Number one. And first, thank you to everybody who submitted questions. Number one, is there on-the-job training for medical coding? On-the-job training for medical coding is generally just training on how to use the systems, the different systems that different facilities, different hospitals, different doctors' offices use, because not everybody uses the same electronic health record or EHR. And so because of that, there's often a lot of times when you're starting brand new that you are getting trained for whatever software they have you using. Generally, they want you to already know how to code when you get into whenever you get into a facility. Sometimes they will train you, but most times they are going to want you to already know how to code right off the bat. So hopefully you will have some supportive coworkers. At least that's always the hope, right? And that you can ask questions. But if you don't feel comfortable asking questions at work, you're more than welcome to come here and ask questions. Okay? All right. Next question. When coding for a medical prison, are they considered inpatient, or would it be like nursing home facility coding? Okay. Coding for a nursing home is not the same as coding for a prison. Okay? It's not interchangeable. Okay? If the patient is in a prison, right, and they go to the infirmary, it is considered outpatient. It's an outpatient visit because they are not inpatient in a hospital. They may be in an infirmary, and they may stay in the infirmary, but it's not an inpatient ward. It is literally just an infirmary. I mean, it's an outpatient setting. That's basically all it's going to be. A lot of times with the prisons or jail, they will take them to a local hospital. But if they're there, sometimes it's just for like superficial lacerations or maybe deep lacerations, any number of things. And if they can't handle it, of course, they're going to send it out to the local hospital or whatever. But it's not interchangeable, and it would not be considered inpatient. It is all outpatient. Unless the patient is inpatient in a hospital, then you would go with inpatient that way. If they're in a nursing home, that is something else completely different. But like I said, a prison or jail would be considered outpatient. Okay. Next question. What is the difference between a biller and a coder? Okay, so I got called a biller coder the other day. I am not a biller. Not all medical coders are billers, okay? That may come as a surprise, but yes, we all don't know how to bill, okay? A biller is a person who deals with the insurance company. Their function is in the name. They bill. They're a biller, okay? They don't have to do medical coding. That's not their function. Sometimes medical coders do carry the function of a medical biller. It just depends on where they are, okay? If it is the same person, then yes, that is the title. However, some people are just the medical coder. So they will get the record, or they will get the encounters from the doctor. They will do the coding, and then they will send it on to the billing people. And the billing people will take care of the insurance company and send it on from there, okay? But not every medical coder is a biller, okay? So we have different functions. I have always been very clear that I do not do the billing. I do know some stuff about billing, but only because I've done my own personal research, not because I've actually had to do it, okay? So there are some people that spend their entire career never dealing with the insurance company. And then there are some that, deal with the insurance company. It's very different for medical coders and very different for medical billers. Their pay scale is even not the same. Please don't ask me what each one makes, because you can find it out through the Department of Labor. Okay, but the technical ability that us medical coders have to have, medical billers do not have to have. Their knowledge base is completely different from ours. It's just like how a medical assistant, how their technical knowledge is completely different from a nurse, a registered nurse. Obviously, a registered nurse is going to have a lot more education. A medical assistant is going to be completely different. It is the same thing with medical billers and medical coders. You do not have to have a certification to be a medical biller, which there's some people out there that get the certificate for medical billing and coding. That is something completely different. That has nothing to do with AHIMA. That has nothing to do with AAPC. And AHIMA, if you don't know, is the American Health Information Management Association, and the American Academy of Professional Coders is AAPC. These are the two major powerhouses that distribute the medical coding credentials. They are the ones that deal with, basically, they have their own, okay? AAPC has theirs, AHIMA has theirs, and we've talked about this several times. I have several videos. If you are curious, please, please, please do yourself a favor, go through the videos and check them out. I try to be very specific on my titles, on what I'm talking about in that video, because if you're looking to ask a question, I probably already addressed it. So be sure to check out the videos, and if you don't see your question answered in one of those, please feel free to email me, okay? But getting back to what I was saying, there is a difference between the two. You do not have to be certified to be a biller, like I said, and with being a medical coder, yes, you do. Very rarely will you ever find anybody who will hire somebody without a medical coding credential. There has to be extraordinary circumstances, okay? Let me repeat that last part again. There has to be extraordinary circumstances in order for a medical coder to be hired as a medical coder without a medical coding credential. So if you are getting ready to take your test and you don't have your credential in your hand yet, it's not time for you to go apply for jobs yet, okay? You have to have your credential in your hand in order for them to take you seriously when you start to apply. Okay, I'm just saying. All right. So hopefully that clears that one up. But yes, I only do coding. Me personally, I only do coding, okay? Next question is, how long did it take you to get the hang of everything? I'm not even sure I still have the hang of everything. I'm learning something new every single day. And it is, with medical coding, it is a constant learning process. Am I more confident now than when I started? Heck yes, because now I know a lot more things. I've studied a lot more, but this took time. And for me to get this confident, it took 10 years. I mean, I think I was confident before then, honestly. But to get to a point where, I know all the ins and outs now. It just took time. And that's all. It's just going to take you time. The more you invest yourself in it, though, the easier it will get. And especially when you're addressing your fears head on. If you are afraid of a certain thing or whatever, like with coding, you shouldn't fear anything. You should be willing to be open to anything, okay? Because the important thing is not to build that wall of, oh, I only know how to do this, so I only want to stick with this because I want to be confident. It's not going to get you anywhere in the long run, because what if something happens and you need to move away and get a new job? What are you going to do if they don't have a position in that clinic that you've been coding forever? You have to start over again. So this is why I always say to keep your options open and be as willing to do new clinics as much as you can, okay? It's not that scary. It's not scary once you start to learn how to find your resources. When you learn to find your resources, you can do anything, because technically medical coders should be able to be dropped into any clinic and be able to pick it up after maybe doing a couple of days of research. I'm just saying. So, next question. What is the difference between using M codes versus S codes, S diagnosis codes? So the viewer is talking about the organic M codes for orthopedics in the orthopedic section, in the musculoskeletal section actually, and then the S codes are the injury codes. Okay, so what is the difference between using one over the other? So organically, if something is going on with your body, like you wake up in the morning and you feel pain, okay, I am going to do a whole separate video about this, so I'm just going to touch on this really quick, okay? If you wake up in the morning and you feel a sudden pain in your knee, you didn't do anything to it, it just all of a sudden hurts, and you visit your doctor and you say, "Doc, I have this knee pain." And he says, "Okay, well, what did you do?" "Nothing, I just woke up with it." "Okay, well, we're going to need to run some tests to find out what's going on. Maybe you have osteoporosis, maybe you have osteoarthritis." It could be anything organically, like the body is doing it to itself, okay? And if you, on the other hand, so then you would use the M codes in that situation, okay, with, or whatever the case may be, the pain code or whatever. But if that same patient says that they got up and their knee hurts, and they go to the doctor and they say, "Hey doc, I woke up and my knee hurts because I was walking the other day on a trail and I slipped and I fell and I twisted my knee and it's been hurting ever since then." That's an injury. You wouldn't use the M code, you wouldn't use the pain code in that situation, because it's not pain. Yes, they do feel pain, but they feel pain because they hurt themselves. So you have to look at what the provider is documenting in order to pick up the appropriate diagnosis code. I have seen people, though, try to pick up just the pain, and they say, "Well, they arrived with pain." You know, well, yeah, well, we don't know. Oh, I want to sneeze. Okay. Hopefully I won't sneeze. So they try to pick up pain, right? And they try to pick this up because they said that the patient came in with pain. Well, we don't know what their injury is right now, so we're only going to pick up pain. Wrong. That's why you have your unspecified injury of wherever the location is, okay? Whether it's, you know, an upper limb, lower limb, or whatever. You would use the unspecified if they don't know exactly what the injury is, because sometimes when a patient comes in and they've injured themselves, sometimes a fracture is not going to show up right away, a sprain is not going to show up right away. There's all of these things that may take some time to show up. But if we know that that patient was injured, you need to pick up the injury code and not the pain code. Because if you pick up the pain code, it is incorrect. The only time that you're going to pick up pain in conjunction with an injury is if it's like a sequela situation, okay? Which, that's a whole another ball of wax. And I don't want to throw you guys off right now, so I'm just going to leave it right there, okay? We will pick that ball up later. I am going to do a whole separate video about that. Again, I have done a video before, but I need to do another one because back in the day, I used to tilt the phone the other way, so it's not as full screen like I am now. Thankfully, I've had some people give me some pointers. Thank you. Anyway, yes. So I will be doing another video about M codes versus S codes. So, but something to keep in mind. Organic is the M and S is the injury. Next question. Can you take an online course learning 3M? 3M is a encoder software. If you don't know what an encoder is basically an electronic code book. Okay. Most facilities use them, and 3M is one of the encoders that is available, and a lot of people use 3M. However, they usually do give you training when you start at a new place. So there's really not any point in trying to take a course. I don't really think there is even a course to how to use 3M. It's very straightforward, very easy to use. I've demonstrated an encoder episode before, so I will probably try to link it in this video so that way you guys can check it out as well. But it's very basic, very straightforward, and it's really easy to get a hang of. So, I mean, I wouldn't worry about trying to take a course for that. The next one, are you a supervisor? Me, personally, am I a supervisor? No, I'm not a supervisor. I am just a medical coder. I wear many hats, and I'm very good at what I do. I'm not trying to be conceited sounding. Please, I am probably one of the most humble people. But when it comes to medical coding, I get very excited. I am one of those nerdy ones that just gets so excited when I learn something or when I'm when I'm sharing something, which is part of the reason that I love to teach. I mean, I really do. I don't have a title of a teacher, but I do like to do instruction when it comes to medical coding. I really do. I don't mind doing it at all. I do have coworkers that do come and ask me for advice, but no, I'm not in any way in any leadership role right now at all. So, yeah. Number 8, is it mandatory that you use 3M? When you are working in a facility and they're having you use the encoder software, a lot of times this encoder software is attached to other software that can run a report on how long you are taking in a particular record. Remember, every time you touch an electronic medical record or you pull up a patient's information in the encoder, it is going to trigger a trail. Every single record you ever touch will be that data is housed somewhere. Sometimes sometimes supervisors can run reports to see how long is it taking you when you're sitting in a record. If they notice that you are not meeting production, let's just say, okay, we're just spitballing here, okay? Let's just say you're talking and you're talking a lot at work, and all of a sudden it's like, okay, what's going on here? Why are you not meeting your quota? Let's go ahead and run a report. And then they see that you have these records that are open for like half an hour at a time, and they're very easy records to code. Why would you be in a record for an hour or an hour at a time? So clearly you're not working like you're supposed to, okay? So that's part of the thing that they use for that. It makes it much easier when it comes to production and speed using the encoder. So yes, you will have to use the encoder, and it is part of the job. Unless they absolutely do not have an encoder and you're using the book. Then that's another story. So, but I'm just saying, yeah, you pretty much need to look forward to using the encoder. Okay. Number 9, do you give yourself a time limit per encounter? Yes, I do. If I feel like I'm getting stuck on a record and I'm doing the hamster wheel, which hamster wheel is just a colloquialism for going around in circles. And when I feel like I'm doing that, I do not let that go on for more than a half an hour. And that is really stretching it, because at 20 minutes, you should be looking at, okay, well, I'm taking too long in this record. Half an hour, you should be out of that record. And if you have not completed it yet, it's okay to put a pin in it and just come right back to it. But you need to come back to it later that same day when, you know, your mind has had time to relax. Because if you start getting in that hamster wheel and you stay there, then your whole day for production is blown. So that's something to think about. Always keep in mind and be mindful about your production. If you feel like you're going too slow on a particular record, you need to come back to it, because don't waste your time trying to sit there and spin your wheels. Or if you can't get help, then, you know, you're sitting there just getting frustrated, more and more frustrated. Just put a pin in it and just come right back to it later on when you've had it time to get yourself going right, and then just pick right back up where you left off. I mean, that's it. So the next one, why are inpatient coding standards lower? Okay, so we talked about this before on another episode. The reason that inpatient records are the standard for those are so much lower is because, I can't believe it's already 20 minutes. Okay. The reason that it's so much lower is because there's no telling how much documentation you're going to have to review. With inpatient coding, you are coding for the entire stay all at one time. And while it may sound like, oh, you only need to do 2 to 3 per hour, 2 to 3 charts per hour, there's no telling how many encounters are in that one chart, or how many rounds, technically they're called rounds, how many rounds are in that chart. Are you looking at surgery notes in there? Are you looking at pathology reports in there? There's a bunch of things that you could be looking at. So that is why it sounds like it's less, but it's technically a lot. It could potentially be a lot of documentation that you're going through. Okay, so that's why. Next question. Do you read self-development books? Yes, I do. I read books from the Arbinger Institute. I have posted them before, pictures of the books, but I will go ahead and keep posting them on my Instagram at medicalcodingwithbleu, at all one word. And it's blue is BLEU. But I do read those. I read leadership books all the time. I have to find the one that I was reading the last time. I do read body language books because I feel like if you understand people's body language, it's a secret weapon, because when you are looking at a person and you can tell just by their body language if they're being receptive to you. You can tell if they are happy with what you're saying. You can tell if they don't understand. And because people are communicating non-verbally. And especially when you're dealing with alpha personalities and people that are very intelligent, they are going to try to keep their cards close to the vest. So in order for you to have a leg up and to have that little way of understanding, reading body language books is very important. That has really helped me, especially with my boys. And I call them my boys. But it's really helped me with them, because a lot of times I can tell just by looking at them and knowing right when I get in their little space, I can tell if they're not getting it or they're not going to be receptive. If I can feel they're not being receptive, I back off, because there's really no point in me wasting my breath at that point. I mean, I don't want to get cut off on this thing, but I've had instances where some of my providers are like, I'm not into this today. And I'm like, oh, I know. I can sense it. But reading those body language books, and while you may think, I'm already learning this coding stuff, trust me, the body language books will help you. And it will also help you to realize how you're carrying yourself. You have to be able to exude that confidence. Because if you don't exude confidence, and if you exude this very meek and shy and very quiet, they're going to run right all over you. Okay? But if you go in there and you're very confident, and you walk in there tall, shoulders back, and you exude that confidence, they're going to listen to what you say. And that's the key right there, because they're used to calling the shots. Doctors, providers, PAs, nurse practitioners, all of them, they're used to being the one that's calling the shots. You have to be able to stand up to that and say, okay, I need this from you. Because they're going to say, I don't have to do it. And they're going to say, there's going to be some that will tell you, because I've had it happen before too, I don't have to listen to you. But you have to learn how to work with that. And in order to work with that, you got to arm yourself. And how do you arm yourself? With being confident and knowing how to get your point across and be an effective communicator. That's the key right there, is effective communication. But I'll be posting some of those, so not to worry. I'll show you guys. This next one is the 24 weeks or 6-month delay in receiving grades a yearly thing? So with the CCA, no, not CCA, CCS and CCSP with a HEMA, if you are taking the American Health Information Management Association, if you're taking one of their credentials, the CCS, the Certified Coding Specialist, or the CCSP, which is a Certified Coding Specialist Physician Base, if you are taking one of those, May 1st and beyond, there could be possibly a delay because they're going into beta mode. And beta mode means these are brand new tests. And so they have to have a certain amount of people take these tests before they can release the grades. So it's just when it's in beta mode. No other credential right now has it except for those two starting in May 1st. So, but it's not a yearly thing. It only happens when it goes into beta mode. Okay. And then the last one, does every medical coder have to give provider classes? I have said before that my methods are very unconventional, and yes, you should prepare yourself to give classes. However, some facilities will have a designated person to give provider classes. But if it is your responsibility, trust me, you are going to want to speak to your providers yourself versus having somebody else to speak to them, because you don't know how they're going to react to that person. I always feel like it's best to keep things as clean as possible and to keep it where if you are their coder, they need to deal with you. Okay, so giving provider classes is one of those things that I'll be doing another video about that as well. But trust me, once you start doing it and get the hang of it, it's going to be a lot of fun. All right, I'm going to go ahead and wrap this one up before it cuts off on me. But if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye.